the budgeting process is to take it just department by department. We're doing that for the sake of, I guess, of analysis here in the in the committee process. But we've got to think broader as we put the budget together and we go back and really work the numbers. Lastly, I'll say, Mr. Castillo, I know you're familiar with these numbers. Heart disease, strokes. Heart disease, 25% of the deaths in Louisiana. Strokes, 6%. Cancer, 22% of all deaths in Louisiana. Chronic lower respiratory diseases. What do you think is the single most preventable cause of death and disease in Louisiana?
Well, having been around a lot of doctors, some personally as well as professionally, I think it's lifestyle. I think it's the fact that people often make choices. For example, if you look at me, you'll see that I'm kind of a large person. And it's a lifestyle choice that I've kind of made. And so I think the issue here is that we need to educate folks that they need to be smarter about the food they eat, what they consume, the habits they have. And some of the things, for example, I know Dr. Cerise had worked for him for about 4 years, and he always felt that smoking was the absolute #1 thing that if he could change with regard to health outcomes in this state, he thought that if smoking were essentially eradicated, the health outcomes would be significantly better. So that smoking, these environmental things, lifestyle choices, I think those probably are the predominant things. Now, there's other things that science can do and services that can be provided, but I think probably, and I think most experts will agree, and I don't count myself as one, but most experts, I think, will agree that those are the kinds of things that would have to change in order to affect public health in Louisiana in a positive way.
And I appreciate those comments. I mean, a lot of the studies and the reports and research I've read recently suggest exactly what Dr. Cerise and what you are testifying to today after your 34 years in the department. I believe that billions of dollars in savings could be effectuated by this state if we were to reduce the consumption of smoking and change people's lifestyles and try to educate them to change their own lifestyles, because like you said, you started with the right word, it's choices. And my point is, finally, that once people make these choices and those choices that they make impose a burden on the state, ergo smoking, then how long do we go and not causing people to pay for and how long do we subsidize their bad choices? You said you're 214 million DHH, that is, in the hole. I have an initiative this year to raise 209 million. I might be 5 million short. Might be about 5 million short. But if we could turn 209 million into 1 billion, that's what you told me just now.
Yes.
If you had $214 million, and I can find Patrick Connick, I think Representative Connick has found the other 5 a little earlier today. But if we could find $214 million and deal with the streamlining of government moving forward and not have this hit and utilize the federal resources that have been provided to save jobs, reduce unemployment, to continue to grow our economy and investing in infrastructure, then certainly I think that's a worthy cause. I don't want to get you in trouble with the big man, the boss. And certainly I've asked you to testify and respond to information that you believe is, to be the case in your 34 years at the department. I would just hope, I appreciate your candor in the testimony that you provided, and I'd ask the members to seriously consider that initiative to help those that are the least of those that are in need, that should be at the top of the list. Thank you, Mr. Chairman.
Thank you. I appreciate you coming today from Monroe. Look, I want to, this card came up to me a while ago. This young man and lady drove in here from, I think, New Iberia, and wanted to offer some testimony this afternoon on some stuff that they cannot be back here tomorrow on. So I think it'd be